That's interesting because I see it as well.
Okay, so recording has started.
Great, thanks, Caroline. We have a couple of minutes, so participants joining, if you'd like to type in to the chat box and introduce yourself, that would be great. And for anyone who's not speaking, to mute your microphone so we don't get the feedback. Thank you. Okay, a very good morning, good afternoon, good evening to all of you who are joining in the first Fresh webinar of 2018. My name is Mohini Venkatesh and I'm a technical advisor on school health and nutrition at Save the Children. Today's webinar is about food and nutrition in schools. As we're commemorating International School Feeding Day in March, we thought it was only appropriate to talk about how to promote healthy diet and nutrition in schools. And in today's presentation, we'll hear about Save the Children's experience in promoting school store regulations and decreasing junk food sales in schools. So over the course of the next hour, we'll hear from two speakers. Each will be speaking for about 20 minutes. While they're presenting, if you have any questions, please feel free to type them into the comment box. And we'll try to answer your questions through the presentation, or we will take them at the end of the two presentations. Now on to introducing our featured speakers for today, Dr. Caroline Hilary and Jeannie Long, technical advisors to Save the Children's school-based health and nutrition programs in Latin America. Caroline Hilary is a German medical doctor and a public health practitioner with several years of experience working in Bolivia and Latin America. Jeannie Long is a public health practitioner who graduated from Emory University, and she supports school health and nutrition programs focused on nutrition, child road safety, menstrual hygiene, and many of the other interventions for health in schools. Now over to our first presenter, Caroline.
Hello.
Caroline, welcome.
Thank you very much, Mohini, for your introduction. Hello and welcome to everybody on this webinar. I see that we have quite an international audience with people in Africa and in Myanmar and maybe other countries. Please type in the chat box your name, your organization, and where you're based. And also, if you have any trouble seeing the slides or hearing my voice, please also type that into the chat box, as well as any questions, technical questions that arise while I'm speaking. So here we see Anna, who's a little girl in Bolivia that we met in a rural school, and she holds up this food, which are bananas. So we asked ourselves, how did Anna get her banana while she's in school? We will look at the sources of food in schools, and according to the source of food, what Save the Children advocates for, with some of the examples of programming. And I apologize to the colleagues that the examples are basically all from Latin America. So where does food come from when kids eat in school? There are basically three sources. They can be school meals or snacks that are distributed to children. There can be a food kiosk or a sale that sells food to children. And there may be food from home that is brought by the students to school. Basically, when schools just distribute food to children, that's like more like a socialist response to children being hungry. So everybody gets them. Whereas the food kiosk would be the capitalist response. You know, everybody's responsible for their own child, for their own food. And food from home can be seen as a third path. We will cover today school meals more briefly with some examples of Save the Children's programming, and focus the second half of this presentation on food that's being sold and how to encourage more food from home. So into the first topic, Anna got her banana as a school snack today. That's an option. It could be that the banana was just distributed to her, so she got it while she was sitting in school. So when we look at school meals, those are the foods that are being distributed. They used to be called school feeding until recently, but people have changed to school meals because feeding sounds a bit as if the children were animals. So we try to avoid the word school feeding nowadays. School feeding may be a meal or a snack. If you look at the picture, which I hope you can all see, these two girls receive a school meal on the left. You can see she has a plate. And the other girl with a little cup has a school snack. Both of these girls are part of a USDA, U.S. Department of Agriculture, Food for Education program in Guatemala. So when we look at school meals as Save the Children, we try to look at three topics for our advocacy or our programming. One is sustainable financing. B is that there are nutrition-sensitive interventions at the same time in schools. And C is the nutritional quality. And I'll go over these three topics. So when we talk about sustainable financing, this picture that you see here is from a harvest day in a school garden in the Dominican Republic. You can see the lettuces that the girls and the boys are picking up. Save the Children supports school gardening if the objectives is skills-based nutrition education. When food is not internationally shipped into the country, either by WFP or the U.S. Department of Agriculture, it is called homegrown school feeding. Personally, I think that's a very misleading name because it is typically not grown in the home of the student, but rather purchased by typically a public local government and then trucked into the school. So when you hear the term homegrown, don't think about a home orchard or home garden that the children are actually bringing food from, but it just means that it's not internationally shipped. Some of the issues that we encounter when supporting school meals are that public funds are used for school meals, which is fine, but they should not compete against learning materials or school maintenance. Sometimes public governments tend to only focus then on school meals and forget that schools need a lot of other things to be able to serve the children with a good learning environment. We also think that teacher and student time should not go into cooking only, and it should be part of their skills-based nutrition education. So if they're really learning something, that's good. But if they're just cooking every day the same meal and the teacher's time goes into that, that's not what we want to achieve. And finally, we'll have to take care of mother's time. In many schools, school meals are being prepared by mothers, typically, female caretakers, and we're going to go over a little bit of those gender issues that may arise. So that's all about financing for the moment. I'm turning now to nutrition-sensitive interventions that should go along with, I'm sorry, something happened. That should go along with those school meals. There are three important nutrition-sensitive interventions that impact on nutrition while they're not food. The first one being obviously water, sanitation, and hygiene. The second one being deworming, and the third one being oral health. Why is it so important? Well, if we have toilets like the one that you see up there, sorry to be putting up a picture that's disgusting, you may make children actually sick instead of healthy. So a school that doesn't have a proper wash management should probably not serve any meals. The second thing is about deworming. We advocate for teachers that can and should be allowed to distribute deworming medication to children when needed. In many countries, we encounter that that is forbidden because there's a scare that children could get sick or could choke on the deworming medication. But our experience and our evidence at Save the Children that it is really a very safe intervention and has a very low cost. In the third one about oral health, we have in many countries partnerships with toothpaste firms to incentivize daily toothbrushing after the school meal. It is very important that children acquire the habit of toothbrushing, especially if they eat at school. The third topic is on nutritional quality. When looking at the nutritional quality of a school meal, we evaluate the calories and the protein as macronutrients, and we look at the most important micronutrients as well. Iron, for example, may be given as a supplement, but the evidence of impact is stronger for having fortified food within the school meals. When you look at children that are older than 10 years of age, the needs vary by sex. So girls have a greater iron requirement than boys when they start to menstruate. And in several country programs, Save the Children conducts anemia prevalence studies and supports weekly iron supplementation as recommended by WHO. When you look at these weekly intakes, which I'm going to explain what the graph is about, first of all, it is better to evaluate the weekly intake because school meals may vary considerably from day to day. For example, if today's snack, if you recall the picture of Anna, was banana, but tomorrow her snack is a corn-soy blend drink, then the protein content is extremely different between both days. But you would still get it if you look at an over the week intake. The graph that I'm showing here is from a Bolivia study, whereas on the lower axis you have different municipalities. And what it is showing is calories per week and also protein per week. The dark bars are the protein per week and the light bars are the calories per week. And this is only to show that depending on where a child lives within Bolivia, the intake is greatly different. In some municipalities, we might be worrying actually about obesity, and just getting too much calories. And in some others, on the left side, the children were basically getting water. Or maybe the frequency of the school meal was so low that actually over the week it was just nothing that they were receiving. So when you analyze the quality, it is very important to look at the macronutrients intake per week and compare them to their nutritional needs. Now I'm going to go into the question of school being bought. So Anna didn't get her school snack, but she actually bought her banana at her school today. Do you think that's really possible? It is possible, but it's rather unlikely. Most school kiosks sell basically sugar, and fresh fruit is commonly not sold. So we will show some examples of how this could be changed. In terms of school kiosks, food is being sold in all schools that I've visited, either instead or additionally to school meals. The main issues that we deal with when looking at school kiosks are, one, regulation versus the small business interest of the person who sells the food. The second one is improving nutritional quality. And the third one is the issue of food hygiene. And again, I will go over these three. So this picture is from a school food kiosk in Bolivia that the parents, through our project and raising consciousness about the bad impact of all this sugar that's being sold, the parents decided that the school kiosk should be closed once per week in an attempt to reduce sugar consumption. However, we think that this is not a very sustainable solution for the small business vendor. At some point, the vendor is going to say, well, I need to make money. So we did some research in rural El Salvador, and we found that kiosk owners claimed mainly about that children should stay inside the school premises, because if they start to sell healthier food, but the children can actually go outside of the school and buy sugary food, the children will still buy from another vendor. And the unregulated junk food from street vendors actually does get into the school. So here's another example. This is about improving nutritional quality. This is from Bolivia. We supported some of the vendors with blenders so that they could make fresh fruit juices, smoothies, or milkshake for sale. In Bolivia, it's typically the gatekeeper who is the vendor at the school, and it's also typically the same person who is the janitor. So we promoted that they sell healthy snacks 1 to 2 times per week. In El Salvador, they implement healthy kiosk policy in schools, also attempting to limit the sale of unhealthy food on school grounds. They are currently working on an obesity prevention program in urban areas that they're piloting. In our research in rural El Salvador, we found that vendors could find a profitable healthy food, such as a fresh fruit, pretty easily, because it was rural and people had access to fresh fruit, like mangoes, for example, that are just growing. But this is not always the case in urban settings. So we need to think about which fresh fruit are actually available and can be sold profitably for the small vendor. And finally, this is about food hygiene. This is a picture from Colombia, also in Latin America. It shows fried food being kept warm with this lamp for long hours until it is sold in a school kiosk. Save the Children supports in all of our school health and nutrition program to train and certify food vendors in basic rules of food hygiene. So for example, keeping cooked food warm for long hours is not a good rule. It either has to be sold quickly or being kept cold, as you all know. But these rules are very important because otherwise you're making children, again, sick through the food kiosk. I'm now going to hand over to Jeannie. Jeannie, if you can take over as the presenter.
Can everyone hear me? So I'm going to move forward. If you don't hear me, okay, Mohini says she can hear me, so I'll move forward. One of the third options that we've talked about is bringing food to school from home, in which case Anna brought her banana from home. This is a possibility. However, in many countries, it's not a common practice to ask parents to send their children to school with food. So this is something that Save the Children has started promoting, where we ask children to and their parents to send them to school with a snack, or to send them to school with safe water, and we do this in Bolivia and Mexico. When bringing food from home, specifically to address obesity, we do want to look at promoting physical activity. We want to take into consideration social equity, and how gender norms affect some of these interventions. The picture on the screen is a kindergarten class in a rural area of Beni, Bolivia, that has healthy lunches once a week. And mothers and teachers have received a nutrition training, which really promotes, fruit and vegetable consumption, as well as gives them tips on how to make healthier meals, such as frying foods less, and making more soups and other things that don't require to be cooked in oil. And this school in particular, as well as others in Bolivia, have decided that their intervention will be mothers or families sending their children to school with food. But sometimes in urban areas, the mothers actually prepare the food and sell it in the school. So they call this healthy recess, and they put that together with something they call moving recess. And neither of these interventions are prescriptive, but we allow the school to select kind of the modality in which they want to do this. But it involves having a healthy meal or a home-cooked meal once or twice a week, and some form of physical activity managed by teachers once or twice a week. As I mentioned, if you're focusing on obesity prevention, it is important to also combine it with physical activity. In Mexico, we have a program that's called the Call for Wellbeing, and it's comprised primarily of nutrition workshops, active play sessions, as well as school gardens for education promotion. And we do that in primary schools and ECD centers. We also train the coordinators of ECD centers to replicate elements of the program. We call it active play and not physical activity because active play aims to involve more children. So you don't have the what you might see in some PE classes where there's a handful of children running and the others are watching, but you're trying to promote physical activity through play and getting as many children moving as possible, while eliminating these elements of winners and losers, which are really typical in sports. Active play in this program also focuses on flexibility, strength, coordination, which are in some mindfulness as well, which you don't see because I haven't put the picture, but there's a picture. They do breathing at the beginning and at the end to kind of calm themselves and get themselves ready. We've also conducted some of these active play trainings with PE teachers in Mexico to promote, more elements of active play in the PE classes. But what we have found generally now after 3 years of programming is that, and I talked a little bit in the chat box to Doug, but I didn't get to this point, is that children's health knowledge and their attitudes towards physical activity and nutrition are improving substantially through this program, but their behaviors are not improving nearly as quickly. And when we survey them in their, in our knowledge, attitudes, and practices survey, and we follow up with focus group discussions, children are pretty honest about why they're not changing their eating habits or why they're not more physically active. For example, in the last school year, we saw that in July of 2017, in our most recent N-line, we found that 70% of children knew how much physical activity they should be getting daily, but only 5% of children reported being physically active every day. And most children were only active 1 or 2 days a week. So what the data suggests is that children in these urban areas of Mexico are only active on the days when they actually have a PE class or when Save the Children is conducting some of these active play workshops. And when we spoke to children about, why they don't play, what we're learning is that there are a lot of environmental factors. When I say environmental, I mean other factors about their lives that are limiting their ability to play. And what we think that is a combination of both parents working. So you have both parents working all day and children living in relatively dangerous areas of the city. They're just not safe. Children can't go outside, and they don't want to do jumping jacks in their living room. So you have a combination of security, economic factors, and then more access to screen time, TV, cell phones, etc. So children have said they enjoy playing. It's one of their favorite parts of this program, but when we aren't conducting the workshops, they're not increasing their physical activity outside of school. When food is brought from home, we need to think about the social equity, and we need to make sure that vulnerable children aren't excluded or discriminated against. Children who don't have food at home to bring to school, particularly children who don't live with their parents or don't have appropriate care, they could suffer discrimination. And in some cultures, food is more likely to be shared among children, but especially in urban settings, perhaps more middle-income settings, these practices may not exist anymore, and food is consumed individually. So the child who can't bring the food may not only go hungry, but also be thought of as differently, and it might highlight their difference to the class. Gender exploitation, which is something that Caroline talked about a little bit earlier. This picture are two mothers in Guatemala, and in this school feeding program, school meals program, mothers in the community take turns about 5 times a month preparing meals and breakfast for children in school. Because of the types of meals, they have to let things sit. They have to prepare for hundreds of kids. This involves getting up at 3:30 in the morning and working till 1 in the afternoon. And it's considered a voluntary contribution. They're not paid for it. So whether food is brought from home or prepared at school, women are typically responsible for cooking in over 90% of the cases. And while Save the Children can advocate for a fair share, we often encounter resistance from men, teachers, school administration, and sometimes mothers themselves who see their space, see the kitchen as their space of power and where men should never set foot. So, and some people may even believe that changing some of the gender roles will foster homosexuality among their children. And I think what we have seen in this particular program in Guatemala is that in some of the municipalities, women have been able to get stipends for preparing the meals. But also, I think in a lot of NGOs, and probably definitely not just Save the Children, we require on volunteering from community members to achieve many of our goals. And so having mothers prepare the meals is a feat, and it helps us achieve our goals. But we have to think about who's preparing the meals and what kind of work that involves. And if possible, promoting some form of payment for those who are giving their time to the school. So in summary, these are the sources of food that we typically find in schools, and many of the issues or problems that have to be considered when we implement these interventions. And I think there are probably more that would be interested to hear about and how other practitioners have dealt with them. The last slide I want to show here is, thinking about what else we can do at a global level. There are a lot of population-based strategies that are attempting to prevent obesity and improve nutrition at a national level. Two of the most common ones, which you may have seen before, are simple front of packaged food labels, like the ones you see at the top that are the cereals with the little black circles, or the stoplight, which is in the middle. And these are meant to make it easier for the consumer to know what's in their food. And this is something that they've started implementing in Chile. That's the example from the cereal, as well as in the UK and Australia. The other national population-based intervention that we've seen is the taxation of sugary foods or junk food. Studies are already starting to look at how effective these are in changing consumer food choices. Obviously, anyone who's worked in obesity prevention knows that changing weight is actually very difficult impact indicator to achieve. It's hard to move the needle on weight unless you have a very intense intervention. So we're often not seeing those types of changes. But in Mexico, where they implemented a soda tax in 2013, results are showing a decrease by 17% in soda sales. Interestingly, in Mexico, in the schools that we work in, what we're seeing is that the school vendors who sell the food find ways to get around some of the policies that exist. There also are junk food policies about the size and proportion of certain sugar-sweetened beverages, for example, that can be sold on school grounds. And the way they get around it is by buying perhaps a 2-liter bottle of Coke and then pouring it into smaller cups or in little baggies with a straw. Probably people have seen that, and then selling that on school grounds. So I think that what our responsibility is as NGOs is to support some of these policies that exist, if they exist, and because it's a right for people to know what's in their food. And in some of these cases, I think, especially in the Chile example, what they're seeing is that a lot of these food companies, they don't want the little black circle that says high fat, high sugar on their food, so they're changing the mixture of what's in their processed food so that they can get rid of that label. And what we can do as NGOs is to support those policies, but also make sure that our schools, our administrators, the vendors who are selling food understand why those policies exist so that they don't circumvent them. But to say that this is kind of the next thing that's happening, and we hope that NGOs like Save the Children and others can start to really support some of these policies. And now we will open it up for questions.
Thank you, Caroline and Jeannie, for your presentations on how ANAC can get her banana in school, and the different approaches that we've seen across programs in Latin America, be it through the school meals or food kiosks or promoting healthy foods from home. We had a few questions during your presentation, some of which you've answered. There was one comment from our colleague from FAO, Melissa Vargas, who responded to Doug McCall on the question of what are we doing vis-a-vis food literacy. Melissa, if you're still on the line, I was wondering if you could speak a bit more to that.
Yeah, can you hear me?
Yes.
Yes?
Yes.
Okay. Well, we're just starting this work, and actually one of the colleagues from Save the Children attended one of our inception workshops. And we're starting to do some work regarding guidelines and principles on what food education and other programs, multi-sectorial programs, need to have in order to have an impact on the long term is food literacy, and then in the short term more on attitudes and practices, but also on capacities to change. So this work is just starting, and it's trying to see food education more as a tool to impact the local school food system, not only the children, but also, as you were mentioning as well, the parents, the school staff, and also in homegrown school feeding, even the local farmers, reaching through education and through other policies as well.
Great. And just for our participants, if you could explain how is food literacy different from nutrition education, for example. I'm asking you because at Save the Children, in many of our programs, we refer to FAO's nutrition education curriculum, and our modules are based on those key learning outcomes. What else do we need to include? And I think, Jeannie, you touched on that as well, but I just wanted to hear from the FAO perspective what that means as well.
Yes, well, this actually, it's a very good question, because we had a whole session. It was a 3-day consultation that we had, and we had two complete sessions on terminology. Because basically there was a lot of confusion between nutrition education or food education and food literacy. And what we decided as a group, we were about 60 people from different sectors: education, behavior change, school feeding, very different sectors were represented. And the outcome was that food literacy is the goal of nutrition education. Nutrition education is the how-to, is the process to obtain, hopefully in the long term, food literacy. Because and basically a lot of people don't like the word food literacy, because they associate it to some sort of, okay, if you're not food literate, then are you food illiterate? But anyway, the idea is that you have, at the end of let's say, hopefully, school systems that integrate nutrition education or behavior change throughout the whole timing of basic education, that you will have more chances of having food literate citizens that can choose that they can choose to maintain themselves healthy through a healthy diet, or that they can have also ability to act, to be agents of change, not only passively to your food environment, but you can also enact changes on your food environment. And this is not only in high-income contexts. It depends on the food literacy changes depending on the context, on what you're able to do. So basically, this is the main difference that we got to that food literacy, or if we're going to come up with another term, is the long-term goal, and nutrition education is the how-to you reach these long-term goals. And also going beyond only attitudes and practices and knowledge, of course, but something that the consumers, children, the school community are active participants, and they are active agents of change. So yeah.
Mohini, it's Doug McCall here. Just if I could jump in a bit, the same discussion occurs with health education and health literacy. And it's a bit confusing because Melissa's right. The health education is the vehicle for health education is the vehicle to achieve health literacy. But that's why I've tried to put in the notion of basic health literacy or basic food literacy as being a subset of the health knowledge, skills, and attitudes that students can learn optimally in schools. In other words, what's the essential set of objectives that learning objectives that we can aim for, and does that essential set, minimum set, affect behavior? And so I think that's a really important question, because otherwise we're just reinventing the wheel of health education or nutrition education when we start using the word literacy.
Yes. Yeah, and sorry, I will just give that my last input. I don't want to colonize, but it was also discussed that we don't want to reinvent the wheel, and then we were also talking about what are the minimum competencies, what are the minimum objectives so you can let's say practice a healthy diet, and it's quite difficult because the different nutrition education or food education programs or other programs, they have they either focus on a set of let's say topics that are general, or they focus on a specific behavior. So the discussion is trying to see what are these principles that an intervention needs to have to put a dent on this food literacy. I mean, what is going to contribute to a food literate person at the end.
Thank you, Melissa and Doug. These are very helpful comments, and actually we didn't speak specifically about health and nutrition literacy and or education, because I think there's a whole other webinar on health education. On this particular webinar, we basically focused on what is really being eaten at school, but I totally agree that the basic of school is actually acquiring new knowledge and changing attitudes, and then hopefully translating that into a more healthier behavior. I did want to add that we did a small study, some research on teachers' knowledge of nutrition in Guatemala, and we actually found that their source of information are basically social media. So they didn't get nutrition education while they were in school or while they were in the teacher's college. But they got their nutrition information basically like from television or social media. And what that meant was that their nutrition knowledge was focused, for example, on avoiding fat. While that is true for adults, it's not really the main issue for children. And when we asked them things about anemia or iron, their faces just went totally blank. They'd never heard of it, because that is a nutrition issue that is very important from a public health point of view, but it's not really present on television or on marketing and those things. So I think when we talk about how this information then trickles down, hopefully, to the children, we also need to think about where actually teachers get their information from. I'd like to take a little bit of time to answer some of the questions that have been written into the chat box, just to make sure that we answer those. So there was a question about space in schools to promote any type of physical activity, or, as Jeannie says, active play in urban areas. Yes, that's an issue, but we also find that schools typically do have at least one courtyard, and some of these active play elements can actually be done in the classroom. So while we do agree that, space may be an issue for physical education that's not taking place in some schools, but it doesn't prevent a teacher from promoting active play within the class. So I think there are ways to get around it.
And then, Caroline, can I add something to that?
Yes, please.
Just to say, in urban areas, one of the problems that we've actually had is, specifically in Mexico, but I imagine in other cities would be the same, is air quality. Actually, one of our biggest challenges is not the amount of space that schools have, but actually air quality. And on some days, children aren't allowed to play outside because the air quality is so poor. So in urban settings, that's actually one of the major limiting factors to playing outside.
Yeah, thank you, Jeannie. That's such an important problem, and I imagine that in some of our colleagues in big urban areas, specifically also in Asia, will encounter the same thing. And we actually know from research that breathing contaminated air is a main factor for developing chronic diseases in adulthood. So that is a major problem. I did want to go over, there's a question from Paula. What can be done to promote clean water for drinking in schools? Should we ban all drinks that contain sugar? I totally hear you. I would ban drinks that contain sugar just because it is difficult to moderate in a school setting. But that's not culturally appropriate in medicine. People just are so addicted, and sugary drinks are culturally so associated with reward or partying. Like if a child has a birthday in the class, everybody buys sugary fizzy drinks. And so it is really difficult. Now, what do we do as Save the Children to promote access to safe water? We do think that access to safe water is a basic human right. And we have experience with water filters in the classroom so that kids can actually get up and, get fresh, potable drinking water in the classroom. We've also worked with solar water disinfection, more typically in rural schools, but in some urban settings, it also works. There again, space is an issue because you need roofs to be able to put the bottles and make sodas water. All of the water disinfection activities, whether, no matter what it is, whether it's boiling or chlorination or filters or sodas, they all require some work, some maintenance, somebody to actually fill the bottle or, put the chlorine or whatever it is. And that is like an extra task. And you need to structure that either into whatever is it the janitor or is it the children themselves or is it the teacher? And that needs to be structured for the practice to continue. But yes, it is a very important issue. And we do think that having access to clean water for drinking is a basic human right. We have a comment from Elijah from Somalia where he says that we found that adolescent girls are shy and they're not being heard by their families. We've encountered that as well in many, many settings. And I think that's a whole different topics about how to empower typically adolescent girls, but also school-age girls to be able to speak out in their family and contribute to some change. And I think I'm going to defer that to a next session on health education, but we do have examples where we found that children can actually engage meaningfully at home about some of these changes. Anybody else wants to talk type in like
Caroline,
either a question or just unmute yourself.
Yes, Caroline, this is Mohini again. I had a question earlier in your presentation about the data you shared from Bolivia on calorific and protein intake in schools. And that's something that even when I think of the midday meal program in India, there are regulations around what children should be getting. And the school management committee is tasked with ensuring that they are getting the required protein and calorific intake. The question is, how does one go about doing that for those of us who are working directly with the schools? What tools should we have to be able to determine if the food has the right levels of the right nutritional value?
Yeah, I think that's a crucial question, Mohini. First of all, I think that governments need to take on a more active role. I've just seen this in Guatemala just very recently. They passed a school meals law recently and just said, well, school boards have to now buy, the appropriate food with the appropriate content directly. And, some of these school board members are actually illiterate. Not to talk about food literacy or nutrition literacy or health literacy. I'm talking about just being able to read. So I think that is really in some cases irresponsible from national governments to just pass on this responsibility to parent boards, because they, parent teacher associations, because they also change. As we all know, those of us who have had kids in school, you do go into the parent board for some time as a volunteer, but those responsibilities are rather major. In Bolivia, what they've done is decentralized this responsibility to the municipal level, but that hasn't really been a good solution for very rural places. So in big urban cities, yes, it's working because they're so large that they can hire a whole administrative unit that actually makes those contracts and buys the appropriate food and does those kinds of analysis. Now, for us as practitioners, there are some websites out there that I can share. The Homegrown School Feeding website has a menu planner that actually takes needs into account, both caloric and protein needs. And we can help use, those types of menu planners. But I also think that, for more sophisticated analysis, we do need to look into, micronutrients, particularly iron, and some other micronutrients that are important as well. So I think that really goes beyond the capacity of a typical parent board to, do those types of analysis. What we can do as Save the Children is to actually promote that the food that is finally getting to the children is at least analyzed once a year. Somebody puts a weekly menu into one of those calculator websites, and to actually look at how much of the needs are we getting at.
Thank you, Caroline. Thank you for that very comprehensive response. Are there other questions for our speakers today, or any comments that you'd like to make for those of you who are either nutritionists or working directly on nutrition programs in schools? We'd love to hear your thoughts as well.
Oh, and sorry, I didn't respond to Natalia Pinzon's question about the funding. So yeah, you're totally right. So we have different types of funding. to develop the programs that we were talking about. Some of it is individual sponsorship. Some of it is U.S. Department of Agriculture Food for Education. So when we actually get food shipped into the country, but we associate it with a nutrition education program. The third source of funding is the one that you are referring to from the industry, from food industry. And I'd like to hand this over to Jeannie because she's been working on a program that is funded by Mondelez, which is used to be called Kraft Foods. Jeannie, do you want to talk about sources of funding?
Sure. So, I mean, what we have seen, and I mean, this is only 2 corporations that we've worked with, is that the focus has been primarily on teaching children to make healthy choices. And that's complicated because children often don't decide what they eat. So, or you know, things like what is sold on school grounds influence what they eat. So, yes, we do have a the Mexico program I referenced, as well as programming in India and Australia, which is funded by Mondelez, and it really does focus on nutrition education and healthy lifestyle. But, you know, with any of these, you really have to pay close attention to what could be a conflict of interest. And I think that that's, you know, there are many corporations in the food industry that are against a lot of the policies that were on that last slide of kind of indicating what's in the food and packaging it differently. So it's something to consider, but we are trying our best to leverage the funding that's available to really, in these cases, focus on improving nutrition in schools and food literacy. I think a lot of school health programming, and I think that the things that we were talking about today, you know, food from home is only one strategy within a larger school health strategy. So in Bolivia, sponsorship programming, they also focus on water sanitation and hygiene and road safety and puberty. And so nutrition education and what's available in schools is one piece of a much larger program. And I think that what working with some of these corporate donors has allowed us to do that are really focused on healthy lifestyles and nutrition is to really develop further the nutrition education component of our school health programming. So I'm happy to talk more, but to say we do accept funds from those donors, and we'll see how that develops over time.
Thank you for that, Jeannie and Caroline. We're actually running out of time now. We've got some comments from our participants in response to that question on the tool to assess the nutritional content of the foods, of the school meals. Thank you, Diana, and others who've commented. We're 3 minutes to go to the end of this webinar. I'd like to thank our presenters for the very interesting presentation today and the very stimulating discussion. Thank you to our attendees. And before concluding, I'd like to say that the recording from this webinar and the presentation will be shared with all of you by email, and it'll also be posted on our Fresh site, more details to follow. And next month, on the 15th of March, we'll be commemorating World Oral Health Day, and our presentation will be from GIZ, and they'll be sharing some of the evidence and programming from their work. And that's on the 15th of March at 9 a.m. Washington, D.C. time. So thank you everyone for joining in today and for the discussion. Thank you to our presenters. Have a good rest of the day. Bye-bye.